The brain has the ability to heal from trauma then. Physical and emotional trauma. Because I feel like the emotional hidden trauma can be more painful and harder to recover for some, the psychological, emotional trauma, than the physical trauma. You can see it and you can treat the physical trauma in a sense, but depending on how intense it is, but the emotional, psychological, hidden traumas, I feel like are invisible and people don't think they need to treat it because they don't see a broken arm and say, I need to go to the doctor because my bone is sticking out, let me put a splint on it and heal it up. We're not trained that way.
There is no easy answer.
Yeah.
But what I will say is that trauma, these are my concepts. I'm not.
Yes.
There's therapeutic trauma, and what I mean by that is resetting a bone after it's broken, the pain of a cancer surgery, but then you know that your cancer's been cut out. Like that's good pain.
Right.
And we're just talking about physical trauma.
Yes.
Then there's emotional trauma if people are attacked. That's also intimately connected to emotional trauma, right? So the people who don't have memory after certain injuries or operations, they never have PTSD because they don't remember it. So the emotional context and memories related to trauma, be it emotional, physical, or a combination, requires memory. That's cool, right? I like to think about like just as a concept. I don't have a solution for. Don't do these 3 things, you'll be better. Sort of not my approach, because when people did that with me, I was like, how do you know what I'm going through, man? You look at me, you think everything's good. Are you sure? Are you sure I wasn't attacked last night? Are you sure I didn't find out that my patient didn't do well last night? Are you sure I didn't find out that a loved one was diagnosed with something? You know, like, I just don't want to put people in boxes. In fact, I want people to know that they are new every day. I'm not even the same version of myself I was before the last few years. How can I be understood as a group of people, a man or a surgeon? You know, I just want people to think of each other as individuals and dynamic. That said, I never judge people's trauma to be better or worse. People are looking or stronger or justified. They're looking at, everybody's going to have a traumatic event in their life, whether it's a car crash or hearing. It's unavoidable. It's partly because we put ourselves out there. It's partly because the way we approach the world is to be completely adaptive, right? If we're rigid, then there's less chances for trauma, but that's a life less well lived. So when you put yourself out there, traumatic experiences are unavoidable. Right. That said, okay? So that said, yeah, you get a bruise.
What I'm hearing you say is that if we don't have the memory of the traumatic event, we don't have PTSD. We don't have trauma. Right. We don't have a trauma detail.
Right. So that's the concept that I want people to walk away and say, memory is important, but memory is the thing that determines whether the event remains traumatic in your heart.
Whether it's painful still for you.
So let's get into that.
So we just need to heal the memory of the trauma.
That's exactly where I'm taking it. Very good. So memories are not files in a cabinet. And actually,
in the brain. How is memory categorized?
Again, there are some regions that if we remove them, you would lose memory. But memory's not only there; it relies on pulling from memories of smell to new. Like, for example, smell is very interesting. It's one of the 5 senses that we can't tamp down with our thinking. So the perfume or cologne, smell and memory are intimately intertwined. Wow. And so you're pulling from all different parts of the brain. Again, memory is a certain electrical flow in the brain. But it's malleable, it's moldable. Just because you have a certain memory today doesn't mean that experience, good or bad, will remain good or bad. Our positive vibe right now can be made negative. Our negative vibe right now can be made positive as we look back at our day to day.
Really?
So when you see memory that way, then you say, okay, wait a second. I was attacked, or I was hurt, or something really traumatized me. And when I think of it, when I smell that smell, when I see that color, I'm traumatized again.
I clench up. I have stress, fear, anxiety. Yeah.
So the emotional the emotional context to a memory is what you can change. You don't want to. You don't want dementia. You don't want to delete the memory because that's a different problem.
Yeah. You don't want to block it.
You don't want. Yeah, but what you want to do is change the emotional context attached to that memory.
What happens if you hear this from people a lot who might have been traumatized as kids, where they kind of block the memory, and then they remember
when it resurfaces,
it's still
raw.
It's very raw.
Yeah.
But they've stuffed it, they've blocked it, they've numbed it, addicted it, whatever you want to call it.
Driven it to addiction. But
yeah, exactly. So what happens when...
I don't know. I don't know about the kid stuff as much, because that's a different space, and I don't want to, I want to stay where I feel real comfortable with what I've been reading and learning. So emotional context to memory for adults, in the right setting with the right person, through, they have their techniques, you can actually work through the trauma of the memory and the experience by going to certain therapists who help you get better with that.
To process the memory.
Yeah, just to take the emotional pain, right? The emotional trauma, and dampen that, so you can say, for example, I was, I'm just bringing examples from my world. Yeah, I mean, when I was diagnosed with cancer, that's a traumatic event. And then you see my patients, you see them over time through different ways. When they say I was diagnosed with cancer and I did this, their face is different describing it later than it was immediately after receiving the diagnosis. So through that's a real life example, right? I'm not. It doesn't have to be all the stuff, related to violence and all that. The traumatic experience of a cancer diagnosis, and how patients cope with that immediately, and then you see them months later, years later, because I'd be a mess, right? I'd be like, okay, I wouldn't be able to cope. But they, surprisingly, not some of them, most of them cope. They get dressed, they come in for their 3-month scans, which to me would be a traumatic experience every time. Is this guy going to tell me it's back or it's bigger? I mean, think about getting that thing in your mail or email. Like, I got to go in for this.
Scary.
News again, but somehow they cope. And that's where in Life on a Knife's Edge, I learned so much from them, that it's possible to cope with traumatic experiences. I'm not saying you as an individual can, I'm not saying I can, but when you look at a group of cancer patients, and most of them cope, live, move on from very traumatic emotional experiences, as well as physical experience of cancer pain and cancer surgery, right? That's the lesson I want everybody to go through in their mind when they're dealing with their own challenges.
Wow. Yes.
There's therapeutic trauma. And what I mean by that is resetting a bone after it's broken, the pain of a cancer surgery, but then you know that your cancer's been cut out. Like that's good pain.
Right.
And we're just talking about physical trauma.
Yes.
Then there's emotional trauma if people are attacked